Namaskar. In this video I will discuss about hypertension, high blood pressure. Hypertension and its complications are a leading cause of death in modern societies. In this stress-related psychosomatic disorder, widespread damage to the heart, blood vessels, eyes, ears and brain may occur after the prolonged elevation of blood pressure throughout the arterial network for months or years. An increasingly high proportion of the population are today prescribed antihypertensive drug therapy for the rest of their lives in order to prevent these complications and an early demise. The vast majority, 9 out of 10 of hypertensives, are diagnosed as having essential idiopathic hypertension, for which no cause has been discovered by medical scientists. A high proportion of these patients do not suffer from any troublesome symptoms. To date, lifelong antihypertensive drug therapy has been the only effective form of management. Unfortunately, the drug regimes available are by no means ideal. They cause major side effects in many patients, who choose to discontinue therapy as a result, even at the risk of dangerous consequences and a shortened lifespan. In this light, the emergence of yoga nidra relaxation as a safe, effective and inexpensive treatment for mild to moderate hypertension is most encouraging both for doctors and the community at large. The effectiveness of yoga nidra in lowering the elevated blood pressure levels of hypertensive patients has been validated in numerous clinical studies. The practice is now widely prescribed by doctors in several countries for patients suffering from mild to moderate hypertension. Yoga nidra therapy, adopted either alone or as an adjunct therapy, has been found to reduce systolic readings, SBP, by an average of 15-20 mmHg and diastolic readings, DBP, by 10 mmHg after 3 weeks or more of daily guided practice. IR13 as a result, newly diagnosed and asymptomatic hypertensives are now frequently capable of restoring their blood pressure to acceptable limits without having to resort to antihypertensive drugs and medications whose side effects, such as sleep disturbance, depression and male impotency, can be severe and disabling enough to preclude their use. In more severe or long-standing cases, yoga nidra is a useful adjunct therapy, enabling a high proportion of patients to significantly reduce or even discontinue their medications. Only a small percentage of subjects fail to respond to this practice.